Well, as the fallout of unscientific, knee-jerk pandemic responses affects the health and well-being of children, there appears to be a collective unawareness as to why this could be happening. Reporting for Rebel News, I'm Tamara Ugolini, bringing you a report that attempts to bridge the gap between the RSV surge currently being seen in children's hospitals with the fallout of the experimental pandemic responses and the vested interests of pharmaceutical companies. In Canada and abroad, children's hospitals are in crisis over respiratory syncytial virus, or RSV. Yet health officials fail to recognize why this may be happening and instead are resorting to what could have caused it in the first place, which are the unscientific, knee-jerk pandemic responses like masking, novel injections, and socially isolating the healthy by way of indiscriminate lockdowns. Dr. Earl Rubin from Montreal Children's Hospital acknowledged the risk all of this had to children during an interview with CTV recently. Listen for yourself.
The flu is here, so we anticipate that the numbers will go up. For COVID right now, we are relatively stable. The majority of kids who are admitted with COVID are admitted for another reason and found to be COVID positive, but with BQ1 and 1.1 and BA 4.6, we don't know what's coming. So that's where that triple threat really is. But at this point in time, it's really RSV that is the issue. So to answer your question, there's kind of that perfect storm that's brewing. We have easy transmission of these viruses. We have a population that is non-immune because they've been wearing masks and distance and not going to school in the last couple of years. So you get increased numbers who are vulnerable. And on top of that, you have kids who are not only vulnerable, but because they don't have immunity are getting sicker. So all of these things are coming into play.
As analyzed by the infamous health data dissector Twitter account Golden Pup, who sources all of his information directly from government sources, RSV cases surged in 2021. But we barely heard a peep throughout the COVID hysteria. His graphs repeatedly show that a term known as seasonality is the likely explanation for surges in respiratory viruses and that mask mandates did next to nothing to stop or break that cycle. Using more broad Health Canada data, he shows how the average number of pediatric hospitalizations of those aged 16 and under has skyrocketed in just 1 week from November 6th to the 12th, 2022. The dotted black line details average hospitalizations from 2014 to 2020. The blue dashed line is 2021 and 2022. And then, wow, look at that solid blue line just going straight up. Pup further pointed out this a few weeks ago that RSV incidences were exponentially higher last year, yet surprisingly, there were fewer kids in the ICU at the same time, 67 compared to 87 this year. And his post dated November 15th, there have been 70,000 doses of the COVID-19 shot administered to children. But sadly, the next part of this report cannot be published on certain platforms because sharing factual data straight from the source that may counteract that certain safety narrative goes against community standards. So you will have to scroll down to a link where it says the full report and you will be redirected to this report in an uncensored version. So I'll see you over there.